Welcome to the video for the Anatomy and Physiology 1 lab at Westchester Community College. My name is Wilson. This will be the video to identify the arteries of the torso model. First, we have the aortic arch. This here is the aortic arch. And for branches off the aortic arch, we notice these three branches. First, we have the Brachiocephalic Trunk. Then we have the left common carotid. And then we have the left subclavian artery. We notice the Brachiocephalic Trunk divides into two arteries here. The first is the right common carotid artery and the right subclavian artery. As the aorta goes downwards, we now have the descending aorta or the thoracic aorta. And this artery in blue is the pulmonary artery. The entirety of this blue vessel is the pulmonary artery. As we pass through the diaphragm, this is now the abdominal aorta. And our first branch here is the celiac trunk. The celiac trunk. The celiac trunk will divide into three branches. We first have the hepatic artery, then the gastric artery, and then the splenic artery. The next branch we have here is the superior mesenteric artery. Superior mesenteric artery. And we notice there's a kidney here. So this would be the right renal artery. And the left renal artery would be right here. The next branches are these two, where we have the right and left gonadal arteries. Right and left gonadal arteries. And then this branch would be the inferior mesenteric artery. Inferior mesenteric artery. The abdominal aorta will eventually split into these two vessels, the right and left common iliac arteries. Right and left common iliac arteries. And each of these common iliacs will further divide into two more vessels, the internal iliac artery and the external iliac artery. And if we follow that external iliac artery, we notice it becomes here the femoral artery. Thank you for watching.